According to report of World Health Organization, lower and middle income countries are affected really badly with asthma because of lack of good infrastructure to support the patient and the basic knowledge about asthma being a little low in the community. Today is World Asthma Day, so let's talk briefly about how we can at least handle the patient and provide emergency first aid if someone is suffering from asthma. To start with, we need to understand what asthma is. So, as we know, we are supported as mammals with lungs. Lungs are organs where the exchange of oxygen takes place. So, lungs are connected with a pathway, and when this pathway gets constricted, that means the pathway which connects nose to lung, it start getting restricted, narrow down, it starts squeezing. So then the victims face lot of trouble in inhaling the air. They feel as if they have to make extra effort to breathe, and breathing being such vital physiological function, patient is absolutely helpless. And if we are not able to provide as community a quick response, many times this can prove to be fatal. So whenever in our vicinity, if we see that someone is feeling difficulty in breathing, they are gasping for breath, like, or there is a wheezing sound coming from their chest, then you know something is wrong. So the first thing, as a first aid response, you should go to the patient and assure and ask, are you feeling okay? If they say they are not okay, then the first thing you can ask is, do you have any earlier problem of asthma? If they say yes, you can ask them if they are able to answer, do you have a puff? Many times the patients who are diagnosed with asthma and they are getting treated with medications, so the first thing they have is they always carry an emergency puff. Is a small structure like this, a small tube like structure. So if they say yes, you help open their bag and find where is their emergency inhaler. I am showing you the picture of inhaler in the picture. So give them, take out the inhaler from their bags if they have. If they don't have and you are in school or college, you can rush to emergency department and request a inhaler. Post you get the inhaler, you give them the inhaler, and there is a strategy that we say 4 into 4 into 4. So first, when you are giving the inhaler, make sure you have second the inhaler so that the contents are mixed properly. Then give them the inhaler and request them to take 4 puffs. So request them in succession, take 1 puff, then rest a little, take 1 more puff, then 1 more, and then 1 more. So take 4 times puff of inhaler. After that, look in your watch and see if 4 minutes have passed. After 4 minutes, ask the patient again, are you feeling comfortable? If the patients say they are okay, ask them to rest. If they say they are still not okay, request them to take 4 more puffs of inhaler. Again, between puffs of inhaler, make them rest. So the strategy I am summarizing once again. So you have to request the patient, after taking the inhaler, take the puff once, rest, another puff, rest, another puff, and then another puff. 4 puffs of inhaler, then 4 minutes of rest. After 4 minutes, checking again if the situation is normal or it is still worse. If it is worse, taking 4 puffs in the same manner. Again, post that, if situation does not normalize, call emergency number, make the patient hospitalized immediately because it can be life threatening because it involves respiration, heartbeat, respiration. These are some of the most vital functions. So we have to ensure that the patient gets right and quick emergency care in the hospital, carry them fast so that we can save lives. If you have any doubt, any query about care of asthma, you can contact us on the number provided below. Thank you. Make community healthy, safe.